Hi, everybody. My name is Gail. I'm a consultant clinical psychologist from the north of England. And today we're joined by a patient who's very kindly offered to share his experiences of being diagnosed with prostate cancer and the effect that this had on his psychological health. So I'm going to be answering his questions and giving some tips and advice about how you can manage your mental health through this very stressful time. So to start, I'm going to ask him to introduce himself. So I was wondering, can you just give us your name and a little bit about your experiences and your diagnosis?
Yeah, hello. Yeah, my name's Jamie. I'm 52 years old. I was diagnosed with prostate cancer about 2.5 years ago, which I had a full prostatectomy to remove everything that was there. Um, yeah, that's my bit, I suppose.
Okay.
Um, yeah.
Great, thank you. Thank you for joining us for the discussion today. So let's get started. What is your first question for me?
Okay, when I was first diagnosed with prostate cancer, obviously it's quite a shock to the system. Is there some strategies or something that would help people deal with the initial diagnosis?
Yeah, I mean, I think any sort of cancer diagnosis is a shock to most people, even if they might have an inkling. I think the confirmation is a shock to the system. And I think, first of all, it's just to let everybody know that that's really normal, that there's going to be waves of emotions that come at different times, and you might have good and bad days. Um, we call it a sort of adjustment cycle. And there's certain feelings that we expect people to go through, like denial and anger and anxiety and depression. And something that can be really helpful, especially in the initial phases in helping somebody to adjust, is to try and maintain a bit of a routine, because there's familiarity with routine and it helps to create some predictability at a time when, you might not know what's coming next. You're waiting for answers and treatment options, but if you know kind of what your schedule might look like over the day, then that just takes a bit of pressure off.
Yeah.
And it can really help to calm your mind down. um, Reaching out to people that you love and trust is always really important. And if that isn't something that feels comfortable, then perhaps speaking to your team, getting support from the CNSs, or even Macmillan as well, have some counselors available to talk to about that initial kind of shock. But if you don't already practice things like relaxation or mindfulness, then those are also some really good things to start trying as well.
Yeah.
It can feel a bit, I guess, fluffy at first if it's not kind of your usual way of managing emotions, but there's so much research that shows it really helps to not only sort of calm our minds, but our bodies down as well. And so the earlier that you start doing it, the better. So yeah, routines, talking to people, and just looking at different ways to try and help look after your feelings, because they're going to fluctuate throughout your whole journey.
Yeah, I know certainly at the point of my diagnosis, it was probably more the denial aspect that I went through. I was sort of like went into almost um, I don't know, an emergency mode that
Yeah.
I just almost went, right, okay, that's it. Let's just get on with it and get it sorted out.
Mhm.
Didn't really absorb what was going on, which later on in the process I suffered with basically.
Yeah.
So yeah, so I think the earlier you accept that this is happening and that you start to deal with it, then I think the better it is for your mental health.
Yeah, absolutely. I mean, the sooner you can start moving along that sort of adjustment, then it is better. And everybody does go through a period of denial and shock. And I talk to people I see on a regular basis about I don't like popping people's denial bubbles. It can actually be quite healthy and protective.
Right.
It gives you a bit of time to sort of mentally sort through what's happening for you. It's when it's going on for a long time that it stops being helpful and starts to get in the way of you adjusting. So yeah, a few days of being in shock, fine. If it's sort of ticking over into weeks and months, then that's more concerning. Yeah.
Okay. Okay. My next question was, I had, as I said, the full prostatectomy, which left me, initially leaves you, a little bit incontinent or quite incontinent. So you're having to wear pads, and that's as a as a man, it's quite a shock, as well, having to deal with that. So is there any way you could, you know, to suggest to deal with that initial, shock of having to line your underwear with pads and stuff like that?
Yeah, it adds an extra level of change for you, really, doesn't it?
Yeah,
Because yeah, you're already having to deal with like post-surgery recovery, and then you've got these additional things to deal with as well. Yeah, I think talking to people
yeah,
is a really important key. Knowing what you might potentially have coming after surgery, because I guess it's not just about the incontinence, but there's also about sort of erectile function,
exactly, yeah, yeah,
and sensation, and sort of body image issues. So being forewarned is often forearmed, and for continence, having some good discussions with continence nurses so that they might be able to find you things that are more discreet. If you have a partner, talking to them about how it might impact on your sense of self and your body image, is really important. That open and honest communication, because it's understandable that people are going to find this hard to talk about. So trying to find that person where you can be a bit more vulnerable with them, is really important. But it's just to know that you're not the only person who's going through it, even though it can feel incredibly isolating when you are, that you aren't, and the professionals around you will have seen other people going through similar things, and they will have some good advice to help you get through it, and to hopefully help you rehabilitate from it as well. But if not, then how to live your life with a good quality of life, managing things in a discreet way.
yeah. And going back to the surgery, you're obviously left with, some fairly substantial scars. Um, so again, it's body image, like you say, and coming to terms with, if if you're going to the beach or going to the swimming pool, or whatever, you've got quite a substantial scar through your tummy.
Mm.
Obviously, um, that might affect your self esteem, maybe,
Mhm.
and how you feel about yourself. Is there any way that you can, help that, like self esteem wise?
Yeah, absolutely. I mean, when we think about body image, there's sort of two key elements to it. So there's like body evaluation, which is how satisfied we are with our body image. So maybe thinking about that before going into surgery, asking to see what post-op image might look like. I'm just thinking about working with women who have mastectomies. They get to see a lot of images of what it might look like, and I think that they should do the same for prostate cancer as well. This is the kind of scarring you might expect, so that you can mentally start to process, okay, this is what I'm going to be dealing with
Yeah,
afterwards, so that you can then look at options for how you might minimize scarring, or following post-op care to try and keep that as minimal as possible as well, if that's important to you.
yeah,
So there's that body evaluation bit, and then there's the body investment, how important our physical appearance actually is for our sense of self, because for some people it's a tiny bit, and for others it's very significant. So I'd say the more important it is, the more necessary it is to have those discussions so that you can prepare and be ready, and make sure that you're looking after yourself, eating well, resting, hydrating, continuing to exercise as safely as possible, all these things that are going to help feed into feeling content within your body and happy with what you might look like post-surgery wise as well.
Yeah. Okay. Yeah. I mean, we briefly spoke about erectile dysfunction. That the biggest thing for me personally has been my sexual dysfunction,
Mm.
which has come after the surgery. Going through different treatments to see if anything can help, and that again is um, quite an emotional journey, really, because obviously, as a man, being able to, get an erection and hold that erection and have your
Mm.
intimate relationship with your partner if you've got one. It's quite an integral thing for a man to have. So, is there anything you can suggest, like to to help that process? It wasn't only the fact that I wasn't able to get an erection anymore. It was the fact that I was having to go through all this different medication. There was injections. There was all sorts of
Yeah.
stuff going on, pumps. There, all sorts of stuff. And it's, as I say, as a man, it's quite an integral thing. So it affects you in quite a deep way, I think.
Yeah, and I think again, it's something that's not always easy to talk about either. Like you say, especially if it's so integral to your identity as a man to be able to have and sustain an erection for intercourse and sex with your partner. To feel like that's been taken is quite a big knock. So again, it's the communication. You
Yeah,
have your partner talking to them about your concerns you might have, and then afterwards, if there are any difficulties, how that might be impacting on you, because then does it affect your desire
yeah,
for
yeah,
sex?
yeah,
Because when we think about intimacy and sex on a spectrum, um, there are so many other things that can be done, and I think um, when sex gets taken off the table, it can feel like, well, intimacy's gone. And it's like, well, it's not. So it's just that's why it's important to speak to your partner that, touching, kissing, holding hands, spending time together, all of these things are really important for intimacy as a whole, so that you don't feel like that area of your life has just gone out of your relationship completely. And when you think about the interventions that are used in order to help men to maintain an erection after surgery, obviously there's a bit of a time delay. So I think spontaneity in sex can be
yeah,
a bit harder to achieve.
yeah, yeah,
So if you've taken the time to speak to your partner about the concerns that you have, to work on that intimacy, then that can feel less intrusive for actually having sex, because you're spending time just being intimate, and you can sort of while away the time until things take effect,
yeah,
to with touching and kissing, and feeling like, well, actually we still have that sexual connection while we're waiting for things to happen in a different way.
yeah, yeah, definitely. Yeah, it's like you say, communication is such a massive thing with your mental health. It's it can be quite a difficult thing as well. For a certainly for your staunch 50-year-old man who's been brought up in the 70s to
Yes,
come
yeah.
in contact with his emotions is quite a big thing, but it is so very very important.
No, I couldn't agree more. I mean, it's something that I do actually talk about a lot with men who I see and treat, that there's so disadvantaged because you grow up being told, big boys don't cry,
Yeah,
be a big man. It's like, actually you really need to connect with these emotions and talk about them, because they're not going anywhere. They're
uh,
going to stay there.
right.
Um,
And
and
like I've said before, is when you bury stuff, you bury it and bury it and bury it, and then all of a sudden, there will be a point that will come to the surface.
Yeah.
And it certainly did with me, you know, along this path.
Yeah. And when you were talking before about sort of your body image and sort of your sense of self and sexual intimacy, when you've got all of that pressure going on internally as well, that's not going to be helping, because men need to feel psychologically well in order to have healthy, intimate relationships as well.
Yeah,
So the problems that come from post-surgery aren't always purely physical, they can be psychological
yeah,
too.
yeah, yeah. Yeah, and the other thing that was quite scary for me is because you don't climax the way you used to.
Hmm.
You know, it's a completely different sensation, and it was always a worry for me is do you lose that? And if you lose that, like, does that take away the experience as well from from with your partner? Um, it's all a big jumble of emotions to deal with. There's all sorts of things. You've been told you've got cancer, which is a massive shock, and it's very, very frightening. Then you've got all this stuff coming after it, which sometimes can run away with itself, so it becomes a blur.
Yeah.
So do you think like you said, relaxation? I got into meditation,
Mhm.
playing relaxing music and stuff like that, just to allow this stuff to process. Do you think, is there anything else that could be done?
Yeah, I mean, I think those things are definitely good. Like I said before, keeping a routine, eating healthily,
Yeah, right.
speaking to people, even doing things like a worry time. Um, so if you find that your mind's getting caught up in what's going to happen or what's happened before, and it's hard to kind of pull away from that, then sometimes we recommend to people that just pick 15 minutes in a day where you can just let your worries out and you can write them down, because then the rest of the time you can almost reassure yourself it's okay, I'm going to have my worry time, where I can sort of let it out for a bit and then look after myself afterwards. Um, there's also another technique called worry tree, where we get somebody to, if they've got something that's going around in their mind, we say to them, okay, so get it very specific what the problem is. And then think about, can you do something about it or not? If you can't do anything about it, then use your relaxation, your mindfulness, whatever it is that helps, and try to let it go. If you can do something about it, what is it? And plot that out. Can you do it now or not? If you can't do it now, then know that you've got your plan, use your relaxation and let it go. If you can do it now, then plot out when you're going to do it and get it done.
Okay. Yeah.
So that just helps. When we worry, our mind is not very good at problem solving. It kind of shuts down that bit, which is not very helpful at all. So having that sort of worry tree, those little questions, can just help to focus somebody when they're feeling a bit overwhelmed, to get to a point where they feel like they've got a solution, and then they can let go of that and move on.
Okay, that's a really good piece of advice. Really, really good. Um, um, yeah, I wished I'd known that actually. Yeah.
Uh,
Okay. Yeah. No, it's something that I've not heard before. So that's really good. Um, and I suppose my next question would be, for myself. It was like all um, this from the getting the diagnosis through to getting the operation done. It was all just 100 miles an hour. It just seemed to run away with itself, and then all of a sudden, I had these where when I was convalescing and getting better and healing. I had this sort of like 3-4 months of not having much to do,
mm,
um, and having lots of time to think.
mm,
And all of a sudden, it hit me like a brick wall. What had happened, and I went into depression. I went into a bit of depression and anxiety, almost like I suppose PTSD. Would you say? Something. It was a little bit. One of the big things was triggering me was I had all the pamphlets and booklets and everything like that next to my bed that
Right.
I beforehand I'd been reading to get myself up to, gend up to what was going to happen, what was going on. But then at the end of it, I had this period of time where when I saw that, it was taking my breath away. It was like, oh my goodness, I've just been through this.
Hmm.
You know, what do you do to really to deal with that at the end of the process?
Yeah, I think that's a really common experience is that, when you're getting diagnosed, it is almost like this roller coaster. You just
Yeah,
go so fast, and then so many people I've spoken to in the past say it's like getting spat out at the end.
yeah,
Okay, you're treated now. You're
that,
done.
yeah,
And then because you don't have stuff to do, it does kind of hit you full whack sometimes.
yeah,
Um, I would say that if you're noticing symptoms of trauma, because a lot of people do experience it as a trauma, it's life-threatening.
yes,
um, and it happens very quickly, and it's done to you. Um, so things like noticing very high anxiety, finding that you're quite jumpy, we'd say that's hypervigilant, getting nightmares or intrusive thoughts about what's happened, that can indicate that you have some trauma symptoms. Now, using things like relaxation is very good to help with that. Trying to get to see a psychologist or a counselor, because they can help to talk through what it is that's happened. Our minds can get a bit stuck in
yeah,
trauma, and sort of go over and over and over, which is why you feel like you can't break away from it.
yeah,
But there are some things that we call grounding techniques, which can help to pull you out of that. And it can be as simple as looking around the room and labeling 5 things that you see, or feeling a texture that's like really soft or prickly, something that you can really focus and hone in on. Using your 5 senses is a really good way of sort of punching through that anxiety, just because it's a bit of a brain hack, essentially. When we've been through trauma or a significant adjustment, our mind is in like this fight flight mode. And so it's going to be going over the stuff that's really scary, and anything that is a reminder, like those leaflets you said, can really trigger that immediate response of, oh, my heart's racing, I'm breathing quickly, and it's
yeah,
that, oh, that thing was life-threatening, that was scary, we need to avoid that. So doing something that's going to calm down the body, can really help in those situations. But I would say anybody who's feeling like those symptoms are quite strong, quite regular, then go and speak to your team or your local mental health service to see if you can actually get some counselling and therapy for it.
is there anything else that you would like to say about it? About anything?
I think it's just overall is that communication is just so incredibly key. It's going to sound a bit cliche coming from a psychologist saying that you should talk about things, but it really is just so important. When you have a cancer diagnosis, people talk about the past me and the new me, and so I was saying you're navigating the new you,
Yeah,
and it's going to take time, and your emotions are going to fluctuate. And I think, you mentioned before about like the scarring that can happen from interventions. Even if you've maybe sort of processed and gone past this experience of cancer, it can still be a reminder.
yeah,
And so it's being able to talk about that even years down the line, it can still catch you, and that's
yeah.
okay. It's normal. But if you're talking to people and you're able to be open and honest and vulnerable, then that's what's really going to help you get through it ultimately.
Yeah, like you say, I think it's that acceptance and saying it's okay to feel these emotions. It's really, you're not being weak, you're not being. you know, it's you've got to have this to process what you've gone through and what you're going through. You know, there's lots and lots of there's also lots and lots of information out there that you can
Mm.
grab hold of, you know, to help you. And really, if you are my advice, if you're really feeling these things, then get help. You know, ask, talk. You know, do whatever you need to do to help yourself. You know, one of the things, be kind to yourself. I used to wince a little bit towards that because I didn't know quite what it meant, I suppose. But be kind to yourself. You know, go out for a walk in the countryside and enjoy the outside. You know, in nature is a massive thing for me. You know, if I can get outside and be outside, then that helps me knowing. You know, even if it's you know, when I after the operation, just to get up for 5 minutes, go outside, sit down in the sunshine or whatever,
Yeah.
and come back in again. Just do that a couple of times a day. You know, it helps so much. It really
Yeah.
did. Yeah.
Yeah. Yeah, being out in nature is incredibly powerful, actually. It lowers heart rate, it lowers blood pressure. So yeah, if you can get outside, even if it is for 5 minutes, it's definitely, yeah, very, very good for you.
Yeah. I mean, what I was doing is just building it up throughout the week. You know, it might be
Mhm.
5 minutes a day for a week, and then, you know, in your healing process, you know, it's an important time, I think.
Right. Yeah, I think yeah, so that I think that's it. We're done. Thank you, Jamie.